Imagine cruising down a highway. Suddenly, a screech of tires interrupts the rhythm, leading to an unexpected accident. After the accident, the patient arrived at the emergency department in severe pain, unable to move his arm. The medical team quickly assessed him, gave pain relief, and sent him for x-rays. The results showed a fracture of the lateral border of his scapula. Before discharge, the patient received pain meds, instructions for care, and a follow-up with orthopedics. The healing process had begun. During the follow-up, the doctor notices something unusual. The patient describes frustration with simple tasks like tucking his shirt, reaching behind his back, or even lifting heavy objects. His scapula appears intact but reveals tenderness over the lateral border, where he suffered the initial fracture. The physician is going to perform the specialized test to ensure the nerve damage is subscapularis. The first one is lift-off test, the superhero move. Imagine your patient is trying to pull off a superhero move, just without the cape. You ask them to channel their inner superhero and place the back of their hand on their lower back, like they're about to pull out some secret gadget. Now here's the real challenge. They've got to lift off that hand like it's ready to fly, but without losing the superhero stance. If they can't get that hand off their back, or they look like they're struggling to channel their superpowers, we've got a problem. Subscapularis weakness. Basically, their shoulder muscles are stuck in sidekick mode when they should be the main hero. The second specialized test is belly press test, the power punch. For this one, the patient gets to pretend they're about to give themselves a victory punch, right in the gut. Not too hard though. You tell them to place their palm on their belly and keep their elbow sticking out like they're showing off a powerful pose. Then they press their hand into their belly like they're asserting dominance. If they can't press hard enough, or their elbow starts cheating backward like it's planning an escape, we know their subscapularis muscle is waving the white flag. No powerful belly press here, just a sign that their shoulder is calling for backup. The lower subscapular nerve arises from the posterior cord of the brachial plexus, which is made up of contributions from the C5 and C6 spinal nerves. This nerve innervates the subscapularis muscle, along with the upper subscapular nerve, and the teres major muscle, both of which are responsible for adduction and medial internal rotation of the arm. If there is damage to the C5/C6 level due to trauma, it can disrupt the nerve signals that pass through this area. The accident likely knocked out this VIP nerve, leaving the subscapularis and teres major muscles like two confused employees waiting for instructions from a boss who's not answering their calls. Without the memo to move, these muscles are essentially on a coffee break, refusing to adduct or rotate the arm no matter how hard the patient tries. It's like they're saying, "We'd love to help you with that whole arm moving thing, but the nerve in charge of telling us what to do, yeah, he's totally ghosting us." So now, instead of smoothly rotating the arm inward or pulling it close, the patient's shoulder is throwing up its hands. Well, if it could move. Rehabilitation and healing time offer hope for improvement. With the right care, the patient might regain smoother arm movements. For now, the lower subscapular nerve's impairment is a significant hurdle. In conclusion, the journey to recovery involves conservative management, physical therapy, medications like anti-inflammatories, pain relievers, and sometimes steroid injections can reduce symptoms and promote healing. Exercises should be performed pain-free. If pain occurs, the exercise should be modified or stopped. Focus on gradual progression. Start with passive and isometric exercises before moving to resistance training. Consistent and proper execution of exercises is key to rebuilding muscle strength and function.